Juvenile idiopathic arthritis. Kids get arthritis too. Presented to you by Nicole Amison, Student Practical Nurse. Juvenile idiopathic arthritis. Today we're going to talk about what it is, some unknown facts, most common symptoms, how it's diagnosed, medical management, nursing interventions, and the disease prognosis. Let's get started. About one child in every 1,000 develops some type of juvenile arthritis. It's estimated that around 300,000 children in the United States have been diagnosed with this condition. Growing up with arthritis can be challenging. However, with care from rheumatology professionals, most children live full, active lives. There are many terms used to describe a child with chronic arthritis. They include juvenile rheumatoid arthritis, juvenile chronic arthritis, and juvenile idiopathic arthritis. What is it? Juvenile idiopathic arthritis, also known as juvenile rheumatoid arthritis, is a chronic arthritis occurring during childhood. JIA is characterized by inflammation of the synovium with joint infusion. It's an inflammatory process. Several types of arthritis fall under the JIA heading. Inflammation normally begins before they're 16 years old and lasts anywhere from 6 weeks to 3 months. The different types are classified partly on the basis of the areas of the body that they affect and the condition's manifestations. The exact cause of the inflammatory process is unknown, and they suppose it has to do with tissue injury from a previous infection process. Other conditions that can look like JIA include infections, childhood cancers, bone disorders, lupus, and must be ruled out before the diagnosis can be confirmed. Here's some unknown facts. Arthritis in children is treatable if they seek treatment right away. The condition is not directly inherited from the mother or father. In spite of their diagnosis, most children live happy, normal lives. Some children actually go into remission, and federal and state programs may provide assistance with school. Juvenile arthritis affects 300,000 children in the United States. That's more than juvenile diabetes, cystic fibrosis, cerebral palsy, and muscular dystrophy combined. Some common symptoms of JIA include joints that are warm to the touch, swelling and tenderness, pain, stiffness upon waking in the morning, decreased physical activity, inability to bend or straighten it completely, fever, rash, fatigue, and favoring one limb or limping. How it's diagnosed. Medical history, a physical examination, laboratory tests, and imaging. Medical management. There is no cure for JIA, but with prompt diagnosis and early aggressive treatment, remission is possible. The goal of treatment is to relieve inflammation, control the pain, and improve the quality of life. The treatment plan may include medication, exercise, eye care, dental care, proper nutrition. Rarely surgery is needed. The first line of defense involves NSAIDs, which are ibuprofen and naproxen. Since NSAIDs can cause GI distress, they should be taken with food. Nursing interventions. A key role of the nurse in care of a child with juvenile arthritis begins through a thorough collection of data. Assessment for difficulties or intolerance should be evaluated. Prognosis of the disease. The course of JIA is highly variable. Children who have systemic involvement may not achieve remission, and long-term treatment may be needed. Early recognition and treatment of the disease may prevent permanent joint damage, and some children will experience complete remission.
Created using Powtoon.